Hello, everyone. We are asking questions about COVID-19 to get answers to you during the pandemic. Today, our health analyst, as always, is Dr. Payal Patel Davlatbadi, Associate Professor of Public Health at the University of Evansville. Dr. Payal, let's talk about face masks. We know they give people wearing them a tool to stop transmitting the virus, but do they offer any possible protection to the people actually wearing them?
Yes, they really do. And really, the whole point of face masks and cloth face coverings is for those who have the disease, but also for those who are asymptomatic. Up to 55% of people who are infected with COVID are asymptomatic. They experience no symptoms at all, which is why it's essential for everyone to wear some type of covering so they are preventing that spread of disease. But also at the same time, for someone who is not infected at all, wearing that mask or covering provides a barrier, provides some type of barrier to the mouth and the nose, so they are less likely to inhale those COVID aerosols. So yes, they are benefit both ways, and face masks and cloth coverings are really part of this big comprehensive approach. In addition to social distancing and good hand hygiene, it's a three-pronged effort in order to remain safe and healthy.
And that takes us right to this question. Those mass, very tight gatherings this holiday weekend. We saw hundreds nationwide this weekend throughout the country. How long will it take to see if there are possible spikes caused by this? Because a lot of these folks were not wearing face masks.
Not at all, nor were they practicing social distancing. So typically the incubation period for COVID is 14 days. On average, though, it can be 4 to 6 days. So I would say within 2 weeks, we should see some spikes as a result of this.
Fall school classes a little more than 2 months away. That's not that far out. Many state governments are waiting on data on whether to reopen K through 12 classrooms. Now, what would have to happen to safely reopening these classes, considering the age group? We're talking about kindergartners all the way up to high school seniors.
This is going to involve much planning and a lot of effort. The CDC has released guidelines to guide those in schools to safely reopen, but again, you have to maintain that social distancing. Those younger children need to know that they have to have that good hand hygiene, and they can't just run up to other kids. And perhaps schools may even have to stagger course schedules and class times just so there aren't many students in one class at one time. So there are a lot of approaches to this, but it is going to involve significant planning. And again, the CDC has released guidelines to help administrators plan to reopen safely.
Well, let's talk about testing and your job. If you learn someone you work with tests positive, what should you do?
Well, if you have had close contact with that individual, then you should self-quarantine for 14 days to see if you develop symptoms. However, if you did not have any contact with that individual, then there is no need to self-quarantine, but it's important to just monitor those symptoms.
And talking about symptoms, asymptomatic, we have been hearing about this, and there are so many types of symptoms out there for COVID-19, but let's talk about flu symptoms and compare those with COVID-19 symptoms and asymptomatic individuals in this situation. Is that the same type of dynamic that you have with the flu if you're asymptomatic?
Right. It'll be interesting. Actually, this flu season coming up, flu symptoms and COVID symptoms are somewhat similar. However, with COVID, you do experience a higher fever as well as significant shortness of breath, which is why the flu shot will be heavily pushed this flu season. So if more people are vaccinated and if people are experiencing these respiratory type symptoms, then it'll be easier to diagnose for COVID. However, it's important to remember those who are asymptomatic do not experience any symptoms at all. So this season, it'll be really interesting with having the flu and COVID at the same time.
Antibodies, what can we learn about COVID-19 if we get testing to see if we are positive for antibodies?
Well, antibodies actually develop as our body's natural immune response when fighting an infection. And they usually develop after a person has recovered 1 to 3 weeks after they've fully recovered. So in testing for antibodies, especially in reopening businesses and schools and universities, it'll be really important. So if person has those COVID antibodies, we know they've been infected, we know they're immune for some period of time, and that way we can really assess what the risk of COVID is in a workplace or in a school setting or even at the university level setting. So it will really be key in order to reopen safely.
All right, Dr. Payal Patel Davladabadi, always great to talk to you. We'll talk to you again on Thursday, and thank you for taking your time with us.